The Discourse starts right now with Cheryl Oates and Erica Barudis.
Welcome back to The Discourse. On this episode, we're going to talk about a topic that matters and impacts everyone: healthcare. So the UCP government has made some aggressive changes to our healthcare, and we are going to get into what some of those details are, what it means for you, and I suspect that we're probably going to argue about the why and how it's going to work.
Well, work isn't the term I would use to explain the current healthcare state in Alberta. Danielle Smith won the election and then blew up the whole system with no real plan to put it back together. Let's remember where this started. In October 2022, Smith promised she could fix the healthcare system in 90 days. Was that a thoughtful political promise? No, but she made it. Then in October 2023, Smith and the UCP announced they would dismantle Alberta's current healthcare system and replace it with not one, but 4 more new bureaucracies. How's that for cutting administrative bloat? The Premier offered absolutely nothing new to recruit more frontline staff, nothing to address wait lists, surgery delays, or emergency room waits and closures. And on top of all of that, the province is said to be shelling out $1 million a day to pay consultants to bring in their siloed healthcare utopia, a system that was supposed to be in place right now. We have Recovery Alberta, which also houses mental health, allegedly, primary care, acute care, and continuing care, curiously fallen down the priority list now. So I would say that not only is the new plan not working, but it's making Albertans sicker, offering less care, and costing taxpayers millions of dollars. Is that the Conservative way?
Well, we are very feisty today, Cheryl. I see. I do like it because I think that's going to make for an amazing show. I do have to give you credit. Siloed healthcare utopia. Beautifully,
It's the dream.
beautifully put in your little rant today. But let's kick it off. I know we've got a lot to cover, lots of changes, lots of, I'm sure, Cheryl Oates criticisms coming our way. But let's kick it off and maybe take a little bit of a step back first for our listeners that don't know the ins and outs of all these changes. And you've alluded to some of them, but for those that are watching and don't follow this every day like we do, the government of Alberta has made several key announcements, ignoring half the stuff Cheryl said, but starting with the removal of the AHS board, creating the 4 organizations that she siloed. I'm not going to add my opinion to it, but primary care, acute care, continuing care, mental health, and addictions. And we are going to focus first, just for the benefit, and I know this is a big one, is maybe start with the primary care. So for those listening, think of your point of care, including your family doctor, the government allowing nurse practitioners the ability to own and run their own clinics. That includes your physio, your occupational therapist, various nurses, including LPNs and RNs. And then again, we're going to get into kind of some of the more details about what that means, as this is one of, I think, what we're seeing with the government, the largest scope and some of the most changes we're seeing to the system. So I'll turn it to you.
Well, it's a great place to start because this is how Albertans access the healthcare system. Most people find their way through the healthcare system because family physicians are the gatekeepers to specialists, to surgeries, to diagnostics, to treatments. And we know there's 1 million people in this province who don't have access to a family doctor. So, I think we're skipping ahead to how would we do it better. But in the midst of a healthcare crisis, I just can't believe job number 1 wasn't get people access to the healthcare system through family physicians. And instead, it was let's blow it all up. Because in terms of access to family doctors, it's only gotten worse.
Okay, so I want to actually ask you about that because you know, in the NDP election promise was everyone will have a family doctor. Why do you or the NDP truly believe that family physicians, I look at primary care as actually a larger scope than family physicians, and that's usually the NDP talking point. So why is it that you're cashing in everything on a family physician?
Well, I think if you looked at the NDP promise closely, you would see that it said everyone will have access to a family doctor when they need one. Because it is the case that not every single health ailment needs a family doctor. So there is a role for nurse practitioners, there is a role for pharmacists, there is a role for chiropractors or other healthcare providers, but a lot of things cannot be accessed without a family physician. You cannot get diagnostic testing without a family physician. You cannot get referred to a specialist without a family physician. As I said, they're the gatekeepers to the healthcare system, and they are also in charge of continuity and care. So if I go see a healthcare provider, I want to see the next one. The next time I come in, I want to see the same one because they know what's happening in my health history, rather than having people give me band-aid solutions. So having access to a family doctor is absolutely paramount. But is it everything? No, and that's why the NDP's campaign promise was worded so carefully.
With like an asterisk, like in when you need it. Nobody.
It wasn't an
nobody,
asterisk. That was the whole
But all we
promise.
heard, all I would say that really resonated was you'll have a family doctor. And I think one of the things that the UCP is actually doing well is looking at primary care maybe more holistically than has been done by any government in the past, and looking at, like we mentioned, the ability for a nurse practitioner to also be a partner in a clinic, a primary care clinic, which I think I would say is the first point of care. Because usually when you come in, you're seeing like your office medical assistant, then you're seeing potentially a nurse. You're going through a few gamuts. And yes, the owners up until this date of a private clinic, to be fair, were family doctors. But I think that we actually need as a society, which I appreciate from the UCP, is primary care, like you said, does go beyond that. And maybe we should actually, as a health system, look at the scope of all those things. We've seen, obviously, pharmacists, I think, are the largest scope in Canada, or at least were up until recently, if I'm wrong. We've seen, the scope of what we do with our nurses and our healthcare aides and things like that, being able to support those wraparound services. So I don't know how you can argue maybe, and we have seen an increase in family physicians and data year over year, and not the ones yelling and leaving like the NDP claimed. We're seeing actually
it's not the NDP claiming,
physicians.
It's literally the AMA claiming that people are leaving and that it's hard to recruit doctors to a place with so much chaos.
Okay, but we have seen an increase in national average. We're above national average on a lot of things right now.
If you add doctors and just as many are leaving and the population grows, you're not really adding doctors. People don't have better access to care. So is it the government to blame
for population growth, though? Because I do agree. I think one of our challenges, regardless of whoever's government right now, it would have been, is our population growth is a critical thing that, as we've seen, is impacting schools and also the healthcare system.
Which is why this should be a priority.
But they are recruiting physicians, and we actually have seen record increase.
Okay, but when you blow up the entire healthcare system without input from frontline workers, without even asking doctors what they think, when you refuse to implement a new compensation model, and when you interfere in the governance of professional bodies, that does not make doctors want to come work here. And of course, it's not the government's problem. It's not their fault that population is increasing. That's a good thing, but it is exactly why this should be a priority for the government over remodeling the healthcare system.
I would argue, though, that you don't have to do just one. And even I'll say,
I would take just one. Just do anything.
But I would say, like, even, and I want to come back because you said the AMA is saying this. I have actually seen quite a shift in the AMA's tone with Shelley Duggan coming in and replacing Paul Parks. And those that don't know him, just go to Twitter. You'll learn all about him. He's very active on there. But I do think, AMA recently to their members talked about the rural health agreement or the rural support program that the government is working on. That branch of the quote unquote AMA membership has always been very supportive of some of the stuff this government has been doing. So much to do a standalone separate from the AMA. They've come out commending. They said there was criticism before on nurse practitioners, but now that they've actually seen the announcement and actually seen the details, they're retracting some of their shitting on preliminary comments and actually seeing this as a benefit for family doctors. And then lastly, they do still talk about a compensation model coming forward and that there's a commitment from the government for April 1.
Late.
So
a year late.
But can you, are you just arguing for the sake that it's arguing? Like, are you?
No, I'm saying it's really important when you meet with a group like family physicians who across Canada, provinces are competing to attract family physicians because every single province needs more doctors right now. When you are in that climate where you're actually competing with your neighbors to recruit family physicians and you promise Alberta doctors you'll have a new compensation model on the table in April 2024 and then don't deliver it until April 2025, not only do you lose morale, you lose trust from the membership, and ultimately we lose doctors in the process.
But we... In comparison, in the Kai-Hai report, that basically, for those listening, is like the national statistics, Alberta is actually not in a bad position. We are across the board above average. We also have the highest growth rate. All of the supporting primary care are above national average, including all of your nurses and all of your supports around pharmacists,
By what
physios,
metric?
things like that. Kai report.
No, but what metric?
It's the percentage of, I'll go double check, but it's like, I think it's also your health spend is on percent of GDP, which we are in the top 10 percentile
Okay, but
in the
spending
world.
badly doesn't mean good spending.
Well,
Like,
that's
just
like
because
the whole entire thing that the NDP did. Just spend.
Okay, but we're not
spend,
talking about
spend.
the NDP. We're talking about the UCP blowing up the healthcare system and then refusing to deal with the
Right,
crisis
but what
that
I'm
is
saying,
existing on the front
Cheryl,
line.
what I'm saying is that all of your stuff is pointing at what I believe is a national problem. We haven't
Sure.
seen the NDP do better in Manitoba. We haven't seen the healthcare in BC. If we're taking it on how we're doing as Albertans, and I get that, like, I don't want to say, like, I don't freaking care what's happening in Saskatchewan because I need healthcare, but it's a fundamental problem that our public healthcare system is facing right now too. But I'm saying in Alberta, we actually, even with this population growth, are not in. You just came off Saskatchewan and said it's the worst in the nation. We actually do have numbers to back up that regardless of this overthrow of the government structures, we're still delivering care.
Yeah, but okay, delivering care is a pretty low bar. Wait times are getting longer. There are more people without a family doctor. ERs are literally having to close because there's not enough people. People are not getting the cancer care that they need. They're waiting longer on waiting lists. Just to like throw your hands up and say, well, this is a problem everywhere is just not good enough. You can look at whatever metrics you want, but out there on the street, out there in emergency rooms where people are waiting double-digit hours, it's not getting better. And when we look at places like BC, where there is an NDP government in power, there's been a new compensation model for physicians in BC for years now, and it's making a huge difference. And if you're coming out of school saying, where should I go to practice? You're going to look where there's a compensation model that best serves you, and that's not here.
Okay, so do you believe that fixing our healthcare, like what it sounds like is that fixing our healthcare problem is fundamental on a doctor's negotiation? Because I don't think that that's one piece.
I think it's
one piece. I don't think it's critical to this. I truly think across our entire nation, our healthcare system that was introduced by Tommy Douglas isn't working anymore. And I'm sure we could talk about that.
There's no way to be competitive in the current compensation model. There is no way to be competitive. And if everyone in the country is facing this problem, which they are, we need to be competitive. So yes, it is a huge issue. But I would say issue number one, and this exists in Saskatchewan as well, is that the government remodeled or is trying to remodel the entire healthcare system without listening to frontline workers. They blew up the whole healthcare system, created 4 new siloed sections without talking to doctors, without talking to nurses, without talking to nurse practitioners who know best what works in the healthcare system and what isn't working. For me, that would be an absolute baseline starting point. And Saskatchewan, this House party refuses to do this. And in Alberta, same thing.
So I just want to come back because I think it's interesting. Like, sure, I don't think there's a case study that you can use in our country of a province that is doing it right. You want to say someone's reached negotiations for physician compensation, and that's going to be the TSN turning point of us having access to family care. I don't believe so, because if you look at the national stats, we're still doing better than BC on recruiting and retaining physicians. So yes, do I think it would be nice to have a compensation model in place? But I also think that, like, sure, a year ago, great, fabulous. But when it has to be about getting it right as opposed to getting it quick, I would rather the government take extra time to reach this, because I think some of the demands, when you gave physicians an extra, what was it, almost 400 million to offset like them mismanaging their own business during COVID. That didn't happen for every other business. Perhaps while we're looking at it, we should not have family physicians be the owners of their own clinics. Perhaps we should look at fee-for-service model as a whole. Like, this is one piece that I think that doctors are going to complain anyway. Maybe we should allow those employees that work for them in a private setting go full public. I don't think that that's going to be the solution, but like, you know, I think you're looking at a very micro piece of how do we fix primary care, because you keep talking about doctors, and I don't think doctors are the solution.
You brought up, first of all, your dad is going to have so much to say about this conversation.
Oh my gosh, I hope he's not listening this week.
And Second, you brought up doctor compensation. I didn't say this was the entire crux of the future
You said
of the
family
healthcare system.
physicians.
Yeah, I
were
do.
The
I
most
mean,
important.
I said family physicians are the gateway to primary healthcare, and they are. And this could be a
Is the
starting
gateway
point
not
as a
the
place
most
to.
important?
Okay,
I'm putting
well,
words in your mouth.
semantics,
Anyways,
but
go on.
but I don't think that's all of it. Like I do think this would have been a good place for the province to start as a baseline starting point, because you can give me all the metrics you want, but the number of people without a doctor in British Columbia is going down, and the number of people without a doctor in Alberta is going up. And to me, that says all it needs to say.
Okay, so let's turn to this nurse practitioner thing, because the AMA now supports it. Thanks, Shelley. How do you feel about it, allowing nurse practitioners to be a part of the funding model? Do you believe that doctors should own their own clinics, like under a true public healthcare model? That isn't really the case. So, like, what do you see with that being a what would Cheryl do?
Yeah, I mean, I think there's a couple of things. Not every doctor coming out of med school wants to own their own business. Like, there's a lot of young female and young male doctors coming out of school right now who are saying, I just want to do my job, be paid a salary, and go home at the end of the day. And I think that they should have that option. And for those that want to run their own clinics and run their own businesses, I think that option should still exist as well.
And that would be beautiful, but like, coming back, like, I think that that's a problem with the whole healthcare. And I know we're talking about Alberta, but because this is a national thing, there is rules within the Canada Health Transfer. I want to get your take, because I've been curious about this all week once I knew we were talking about healthcare. Is like, do you think that the public healthcare model is actually like no longer working?
Do I think public healthcare is bad?
No, I didn't say bad. See, now you're putting words in my mouth. I
No,
mean, like, I
Erica.
actually see the model under Tommy Douglas is like no longer feasible for the size, for the emigration, all of those things. And I want to get your take.
So
Because I'm
like,
obviously going
no,
to
I
disagree
mean,
with you.
I mean, I don't think you'll be surprised to hear that I support public health care. Absolutely.
So do I, but we still have private clinics. We have private MRIs.
But what-
we have people traveling to different provinces. Like,
but those are
do
Band-Aid
you believe
solutions.
we should just stop that?
I mean, it's hard to just stop it at this point, because the system in other places, like, we just don't have the capacity to even offer the most basics of healthcare. But in a perfect world, I would love to see all of that under the public umbrella. I would love that people didn't have to go to private options because the wait lists were too long in the public system. I think all of it should be public. But is that possible at this moment in time? Probably not.
Do you think it's realistic at all anymore, just given the amount of healthcare transfers from the federal government to the province has been a long time fight? Like, I just don't think that the original model and intention can actually thrive without, again, blowing up the entire national healthcare program.
Well, I mean, when you have a party like the UCP who is undermining the public system by bringing in private surgical clinics to take the easiest cases and then work to a profit line on getting as many done as possible, no, I don't think the public system's going to work that way, because that just puts pressure on the cases with complications to exist inside the public system. And it pulls resources from the public system as well. So yeah, when you have a government in power that is actively undermining the public healthcare system, I think it would be easy to say, well, shucks, this just doesn't work anymore. But when you really are dedicated to properly funding the system, properly managing the system, and protecting public healthcare, I do think it works.
Do you truly believe that if you had no private offerings of services or private contracts, like, I guess, okay, so if you have that scenario, how much more do you need to dump into the public healthcare system? Because we do still, I'm frustrated by it, like the highest amount invested into healthcare with not the best, like if it equated, it would be the best to the best delivery of service. And I do know from looking at stats, like we are above the national average. We are doing well. Again, that doesn't answer someone needing to get their kid care in a moment. Like, as a national average, I'm not that out of touch that to know that, like, that doesn't really mean anything for an average human. But again, like, what do you think that how would you do that? Like, I just think it's like, like you said, have we gone too far down this way of like family doctors having private clinics, people traveling to other provinces to get surgeries. And like, I didn't know this until recently, is like, you're considered uninsured under the public health of Canada if I go to a different province. And therefore, that's why I go to a different province to pay for a surgery. And like, look at Cambie Clinic in BC that's been NDP forever. It's huge and makes so much money and is like a very big entity on offering those surgeries for hips and cataracts and knees and things like that that people need. Like, I just still think the whole federal system is broken on public health care.
Well, that works well for what the UCP is doing right now, doesn't it? I think, like, truthfully, yes. Is the system, like, is there too much money in the system for what we're getting out of it? Absolutely. That's been the case for decades now in Alberta and in every other jurisdiction in the country. Could the public system run leaner? I'm sure there are ways. The problem is that there's no quick fix. There's no, like, you can't drop a solution on top of healthcare in Alberta and have it fix all of the problems and work in what is quite a diverse province when you talk about rural, urban, and the different areas like north and south. And the different demographics that live there. But fundamentally, like for me, I want two things. I want to make sure that every single person can access quality healthcare no matter how much money they make. So it doesn't matter who you are, it doesn't matter how much money you make, you get access to the same quality of care that I get access to if I can afford something else. And secondly, I want to make sure that those who are offering me healthcare, those who are treating me, those who are doing a surgery are driven by the quality of my care and not profit. I don't want to be pushed off the surgery table as fast as I can, as the surgeon can, to get to the next one because he can make more money that day. I want to get care in a public system where we are not driven by profit, where we're driven by service, and we are driven by quality of care.
And you know what? That sounds super ideal. I just don't know if I believe that that's fully the reality. Question for you on that is like, if there's a queue, and then the queue is going to stay the same in the public healthcare, and if you can afford it, you can go to X province or the states. Does that, I just want to understand your logic, because like, to me, I'm like, you know what, if someone wants to go pay to get that MRI, I'm fine, because that actually, if I needed an MRI, bumps them off the list. And so like, what's the rationale on the other side of being like, yeah, that sucks that this individual, but we have people leaving our province and we have people leaving our country all the time to get those surgeries. So like, do we just not incentivize it or make it impossible, therefore making the queue longer? Like, I get that if we could actually, but what I'm saying is I just don't think this system is designed for the emigration and immigration and all of the things we're facing right now in a true ability to have public health care in its fullest form. And so how do you think that works?
Hiving off private pieces of the healthcare system is not a solution either. You can look at jurisdictions like Saskatchewan where they brought in private surgeries and their wait lists went up. It's not like I hear this argument all the time. Just take part of the wait list in the public system and move it to the private system, and then everybody will get care faster. It sounds lovely, but the data shows that that's not the case. Those private clinics are going to take the surgeries that they can do the fastest. They're going to take the surgeries with the least complications. They're going to move things through as fast as possible. And when people have complications or need post-op care, they're going to send them back into the public system. And the public system is going to deal with all the complications. So we've seen, you don't have to imagine it. You can go look at the data of places that have brought in private surgery clinics, and it does not decrease wait times.
Where
it does
is
not
that data for our listeners if they want to know? Because you challenged me on my data.
You can go look at
I just actually don't know.
Of the wait list times. Go look at Saskatchewan when they brought in private clinics and look at whether wait lists got shorter.
Will that data actually equate for someone to look at it? Or is that an analysis done on numbers to say, oh, well, it actually didn't equal? Like, it's not considering other variables, like in a huge increase in population or the baby boomers needing more care because they're getting older at this critical time and therefore a higher percentage. Like, I guess I'm just saying it's like you're using data, I think, in a misleading way.
And you have not done that this whole episode so far.
No, you're twisting yourself into a piece of paper that was.
You're twisting yourself into a pretzel to make private healthcare work. But it doesn't. It has never.
I don't think we need. I like the idea that we have public health care. I'm just saying that there's areas where sometimes I think there is a solution to look at an alternative. We do have it happening in our problem. We do, to some degree, have a two-tier healthcare system. So I think it's bullshit to not call it two-tier healthcare system, or that we should explore all opportunities. And that if we want to give people an opportunity to, if they're not going to get it here in Canada, they're going to get it somewhere else in another province, because that's how our model is set up right now. And it's unfortunate, but it's just a reality. So like if we're going to start looking at how we fix this, I think hitting reset and coming back to what we were talking about is like how the primary care model or all these other models work. Sure, there's criticism in anything you're changing, but if you're isolating it to then make that system work, I'm still fully supportive of it.
Okay, well, let's talk about
your favorite. Let's go to your favorite topic here.
Yeah, I mean, one of my reoccurring frustrations with this government is that it fiercely defends its own jurisdiction at every possible opportunity. And then when it comes to arm's length organizations, it has no problem overreaching. And then the healthcare system is a great example of that. So, the government blowing up the healthcare system, adding more administration, concentrating power in the hands of politicians. This is not how the healthcare system was designed to operate and not how it has operated in Alberta for decades now. But under the UCP, control in the cabinet. Is that the Conservative brand?
Is that the second time you're going to leave it? Is that conservative? Is that the right thing
to
do?
Well, is it? Because you always talk about you love small government.
Yeah. I wish that a government didn't need to intervene. I wish systems worked the way that they were supposed to, and that government didn't need to involve themselves at the micro level. But in this case, I think that we can all agree nationally or in Alberta alone that healthcare isn't working right now, and public access and access to care is not just an Alberta issue. And so, yeah, do I think that putting decision making for a long time at the cabinet or putting decision-making power or heads in roles outside of what needs to be a critical moment? I'll be the first one to shit on this government if they don't remove some of the things that they've put into AHS. If, like we said, when I said you could be critical of Nate Horner is still chair of AIMCO, that's been addressed. As long as these are short-term injections of government, I can tolerate it. And listen, I would love if I didn't have to sit here and talk about it, but I do think that we're in a society right now where healthcare is pretty messed up generally across the board. I don't think anyone's getting it right. I don't think there's anywhere in the world right now that I can point and they're they really figured it out and they made these adjustments. We do also, one of the things that I hope, kind of pivoting away from the government overreach, but I hope as a society that this is where we get is some of the more proactive and awareness pieces. So I hope by making these silos that the government can create a framework where there isn't just reactive care, but a lot more proactive care, because I think that's kind of how we've got to this in the first place. We have people choosing to take Ozempic over healthy eating and going to the gym because it's a quick fix. We have people that have created a culture and huge segments of the population that complain about healthcare, and these are the same people that don't proactively invest in their lifestyles and healthcare. And I think that goes so that the people that actually need it, that can't help it, aren't getting access to care. So I think there is some changes that we can make as a society that also address that. Mental health and addictions, and I know you mentioned it above, and happy to dive into that a little more, but mental health is a huge piece and a huge impact on our healthcare system. And I think a lot of that comes to education, awareness, and proactivity, and knowing your options to try and get in front of some of these things. So government overreach, I will take a little of it and I'll bite my I want small government all the time, because it's kind of, I think, some areas where they've had to involve themselves, but they better damn well get out of there. Because I'll be the first to be critical of them staying too long where they're not needed.
Okay, so
did you get all that? Did you get all that? Want me to repeat myself?
I just want you to imagine the year.
You're you saying something short. Okay, yeah.
The year.
Gross. I was crying.
Oh my God! Stop. The year is 2015. And the NDP have just gotten into power, and Rachel Notley announces as premier that she's going to dismantle the entire public healthcare system and create 4 new organizations and 4 new sets of bureaucracy. How do you think the Conservatives would have reacted?
Well, you know, it was funny, and I will answer this, but I did think about how I looked at healthcare before. And I think that in 2015, I probably would have had the same mentality. But at this point, when it's just been so elevated and emphasized, so I remember, and this is probably not the best thing to say, but when I worked in the legislature and with the PC government before you guys took over, and I remember the saying was kind of if you're the minister of health, you just got to tread water. Your goal is to not make it worse. And that was over a decade ago. And shitty thing to say now, but that party doesn't exist anymore, so it's fine. But that was almost the mentality of how much reform needed to happen. If you guys came in, I would probably be you just got to tread water, Sarah Hoffman, right? You got to just keep it at bay. No change is good change. Everyone will be happy. And I think that that hasn't fixed. Nobody's been able to fix the problem. Your government, two different conservative parties, until now. So I get why the opposition is lighting their hair on fire, making this political, because it is change and it's reform. And it's going to take time. As I will say on last episode, you said that it will take more than 4 years, not 90 days, obviously, but over 4 years to reform healthcare. And I truly believe that. But I'm very optimistic that this is the type of reform that needs to happen. And I'm just really glad that someone did it. I get the politics of it. So I would say if it was 2015, and by then I was Wild Rose, so I sure as shit would have been lighting my hair on fire about how corrupt and chaotic the NDP were in making this decision. But that's politics, not policy.
Did you answer my question?
Yeah, I said I, in that time, would have played the game of politics probably like you guys are right now, because it's good politics for you guys, not good policy. But I like to think I've evolved since my time with Fred Horn as the health minister. And I think it's just actually good policy because it's just so needed.
Okay, but just because you have a problem.
Look, I can answer it quicker than I did.
Just because you have a problem doesn't mean every solution is a good solution. Does something need to be done in healthcare? Yes, absolutely. But is blowing up the whole system and then leaving it hanging for months on end with no progress and worse outcomes, is that the solution? I would say that's bad policy.
I don't agree with that. There hasn't been more negative outcomes. We've done more. Our emergency department has increased its amount by 20%. Yeah, the wait times have stayed the same. In fairness, they haven't gone down.
Up. Some emergency rooms are literally closing because they don't have staff.
So when you say emergency rooms, or are you talking about also clinics? Because a lot of the stuff that's reporting about rural media is about clinics and not being available. A lot of times about clinics and the emergency are tied together.
You can call it whatever you want to call it. I'm saying the access for that community to emergency care is unavailable. So that means that when you have a problem, when your kid needs to go to the emergency room and you show up at the emergency room, it's closed and you have to drive down the highway. That's the kind of care that rural Alberta is getting.
I know that there's been certain cases, but I don't think that our wait times are actually drastically improving. I think there are areas that have some time, but I don't think that I don't think blowing up the system is equaling wait times one way or the other. The system still is functioning, but it's not like we've getting better. Everything.
It's supposed to be getting better.
But that takes time.
It's in crisis. It's in crisis. People literally cannot access the healthcare system. So
what would the NDP do?
Well, start by getting more family doctors, like I've already said.
Cheryl, you can't pop up a family doctor overnight. You can
introduce a compensation model that would attract and keep family doctors in Alberta. You absolutely can.
And they're going to, but they're going to do it right. In fairness, I think I'm trying to be empathetic for you being yes, the sooner the better. But honestly, family doctors were asking for a lot of ludicrous needs and high demands. And I'm sorry, there is a fee for service model that needs to be reviewed. I think that there is how their offices operate and billings. There's no incentivization. If I was a doctor, I'd be incentivize me to work in the evenings and the weekends.
But then
and that to me would be a better compensation model.
But they promised it a year ago. So
well,
if
then
it
they
was
should.
so,
I would say just don't fucking promise things if you can't keep your
well,
timelines.
that's also a good
But I
place to
think
start.
there's also been how many times that the doctors walked away from the table, or they were having constructive meetings, and then they go in, like Paul Parks goes out and just yells into the media how bastardized this system is, and blah blah blah. And I think that there's a lot of relationship building that hopefully, I will say, I'll give Shelley Duggan credit. I think she's going to like repair some of those relationships that were damaged under the last administration.
How come this only goes one way though? Because the government has targeted doctors by not talking to them at all when they restructured the whole healthcare system, not caring about their input, and then also intervened in their professional governing bodies. Like if I was a doctor, I'd feel a bit, combative about this as well, but only the doctors have to wear that.
No, I think that the government has gone back and forth quite a bit. They did also give them one renegotiating a contract not within the years, but 18 months after one was reached. So I think that that is like an olive branch. I also think, what was it, 397 million or whatever it was of like a one-time injection. To me, that's an olive branch. So I'm not saying that there's not, some compromise or reflection by the government. I'm just saying that like we don't see the government coming out as harshly as what we've seen from AMA's previous president. I'm hoping that those conversations that can be constructive behind closed doors, not made public, and been like crying on X, but instead are constructive. And again, I think both parties could step up a little bit on how they're going to have their relationship and interact. So I'm not letting the government get off on this at all.
Okay.
Moving on. See, I left you speechless because you were like, oh, she's so
It's
right.
just not worth it.
Well, let's move on to our last segment. And maybe let's see if we can focus on outcomes rather than why our party does this and why we are right and you guys are wrong. But instead, maybe let's look at, I'm still trying to make this catch on, but what WWBOD, what would Barutis and Oats do?
Wow, that is catchy.
Isn't it? Yeah, there's going to be like bracelets made for sure. And then maybe let's have a little bit more kumbaya as opposed to go to for the jugular on emergency access and outcomes. I'll let you start.
Okay, well, which piece do you want to start on?
Well, I just think like the overall approach of like why our emergency system is in the state it is. We do have, I think, like, again, I read a report or several, like national average, we are seeing the most. The time to see, especially on like critical things, is faster than the national average. I think we are seeing some benefits of some of the policies put in place. But I'm thinking maybe like, yeah, what's your take? Let's go to this one, like on how mental health and addictions impacts like acute care, even primary care, but how we're seeing that in society too as kind of a challenge for access of care.
Yeah, it's challenged an already challenged system, like a huge expansion of people who need mental health care, not enough resources to deal with what we had before the expansion of people who needed access to mental health care. And I think also when it comes to addiction in Alberta, we've sort of gone back and forth over what's the best way to approach that. And the province has landed on one way and one way only, which I think is limiting for people who are dealing with addiction.
And so just for our listeners, like it's gone to what the government calls compassionate intervention. What Cheryl's talking about from previous was like the safe injection sites, or what's the word you guys use for it? Anyways, so, I think the one thing that I look at is like one size does not fit all. The government is taking more of a like recovery approach. One thing I will be critical of the government is this last silo, which is mental health and addictions. And I don't see much on the mental health side. Like what's your take on why that is its own organization and how it addresses both mental health and addictions, if you believe it does?
I don't believe that it does. I mean, mental health and addictions have to go somewhere. Obviously, addictions is going into Recovery Alberta, which is its own arm, but not every mental health issue is a addiction issue. And so, just to call it Recovery Alberta leaves out this, pretty big portion of the population who are dealing with a variety of mental health issues. And now they all fall into this umbrella of just recovery, which, I mean, I think makes it harder for people to access. And I also think it sends the wrong message to Albertans.
And again, trying to find the kumbaya here, I would say like that is one of the things I am critical of this government on is I get putting primary care as its own organization. I get acute care because of emergency services and moving away from the traditional like AHS does everything as they were meant to be kind of that acute care. I get the continuing care, especially for all of the different services of like aging in place to needing more hands-on care and that whole spectrum for the later in life or needs every day of your life. I get that. I do think, again, I think mental health and addictions is critical. Part of me thinks that addictions, some of it goes into like the model of some of it goes into primary care, some of it goes into acute care. I don't really know how it's a standalone. And I think my biggest thing is like, where's the mental health component? And
But
maybe I'm just missing something.
Yeah, and this is sort of the problem, I think, with the entire idea of siloing the healthcare system is that all these pieces interact. Like, how do you originally get into the system? You get in through primary care. How do you originally get in the system if you have an emergency? Through acute care and emergency services. Is it possible that you're treated through primary care and you have mental health issues at the same time? Absolutely. So why would those things exist in silos? Why would emergency care be separate from mental health care? To me, that's why our healthcare system was one big organization, because it's an ecosystem that all works together and all the parts have to fit together for people to get the fulsome care that they need. And now instead we have 4 silos that exist and a different bureaucracy to oversee all of them. And I just don't see how that improves patient care.
I think from a patient experience model, like the first 3 do make sense to me of like, you might need acute care, which is not whatever I go to my family doctor. My my family physician deals with anything mental health related. And that's, I think, where, again, and then addictions is not the entire population. I think there is times as a patient exploration, I'm going to need primary care. I'm going to need acute care. I'm going to need continuing care at some point in my life, right? Like those all make sense. And I do think that the model that they've set up, time will tell, but there is a mechanism for that information to be shared and collectively, like not making it a silo, but actually having it fuse properly, but that there are these individual ecosystems part of a bigger ecosystem. Again, my biggest criticism is this mental health and addictions piece of it, because it's just not super clear to me on what their scope is that wouldn't bleed into the others. And I would like to see more mental health focus, because I think tying it to recovery is not something that I think people that maybe aren't dealing with it in the same addictions way or over, needing recovery. You don't recover from bulimia, anorexia, things like that. Like you don't recover, and in the sense that you don't need to go quote unquote get clean. So I think it's just like a miss on how much they've leaned into the recovery side. I have my whole rant on compassionate intervention, but that comes back to my nanny stating feelings. And I just don't think one size fits all. So that's just the only one when you look at these 4 pillars that I'm like, I don't get it.
Well, on that we can agree.
See, look at it. That's so beautiful of us. Yeah, I mean, I think we've covered a lot of the stuff we wanted to talk about today. But, I think that I'm optimistic. I think that there was such a big 180 needed on our healthcare system that I'm optimistic. I obviously, as always, have my criticisms of how anything is done, whether it's my party or not. But I'll let you close us out.
Well, I am also optimistic. I think this was the wrong thing to do, but I really hope it works for the sake of Albertans, for the sake of those who need access to the healthcare system, for the million people who do not have a family doctor right now. I do really hope it works. And with that, we're going to call it. This is another episode of The Discourse. Make sure to like and subscribe on YouTube and wherever you get your podcasts.
And we will see you next week with another episode. Drop in at Thursday at 5 a.m. See you then.
The Discourse is hosted by Cheryl Oates and Erica Barudis. Follow on Instagram @TheDiscoursePod. Subscribe to the Discourse on YouTube and wherever you get your podcasts.